Go for it.
Are we good with that?
Yes.
Okay. If there is anything we should be able to rely on about our government, it is that the public's health is in good hands. After all, we elected a nurse to be our governor. And if there's anything we should expect from our Department of Public Health and Social Services, it would be to take every measure possible to guard all of us from disease and deadly epidemics. Ironic as it may seem, it is under this governor that the first local case of dengue fever has occurred in 75 years, for as long as we've been celebrating our liberation. Could it have been avoided? Did public health do its job right? The Department of Public Health 3 weeks ago first told us that a traveler to Guam was suspected of having dengue fever. On August 20, we spoke with Rosanna Rabago from Public Health's Division of Environmental Health to understand more about dengue. The Division of Environmental Health is in charge of the island's mosquito vector control program. We even used more than $1 million in federal funds to build a mosquito laboratory to, among other things, monitor dengue and prevent its onset here on Guam. The dengue virus, which causes the fever, is carried by a certain type of mosquito, according to Ms. Rabago. If a dengue-carrying mosquito bites a human, the virus can be transmitted, making the human sick. 3 weeks ago, while that traveler was suspected of having dengue, there was good news and there was bad news. The bad news was that public health had detected the presence of the very mosquito capable of carrying the dengue virus. The good news at the time was that none of the mosquitoes they tested on a weekly basis actually had the virus in them. So we asked Ms. Rabago at the time whether it's possible for one of these mosquitoes to bite a dengue-infected person, like the suspected patient, and acquire the virus and spread it to other humans. The short answer, yes. Alarmed, we asked her whether the person suspected of having dengue was quarantined from an environment where one of these mosquitoes could bite him or her. She told us that wasn't her division. We needed to get that answer from her colleague within a separate office at Public Health, the Office of Epidemiology and Research. Ms. Rabago referred our inquiry to Dr. Ann Pobutsky, who is the territorial epidemiologist at Public Health. Dr. Pobutsky answered us, stating there was no need to quarantine a person whose dengue suspicions had not yet been confirmed. But within a couple of days, the confirmation came. The patient tested positive for dengue. During the entire time this person was on Guam and was suspected of having the virus, no quarantine was done to prevent a dengue-capable mosquito of acquiring the virus from this patient. Whether 1 or 100 mosquitoes bit this patient while the dengue virus was capable of being transmitted from the patient to a mosquito is unknown, but at least one did. Last week, Public Health confirmed that a local patient tested positive for the virus. The patient had no recent travel history. That means a mosquito carrying the dengue virus bit this patient and transmitted the disease. We wrote back to Dr. Pobutsky, reminding her of the concern we expressed for the quarantine of the first suspected patient. Since at the time she felt quarantine was not necessary, we asked, now that we know there is at least one dengue-carrying mosquito on island which caused the virus to infect at least one person, do you now believe that those who were earlier suspected of having dengue should have been quarantined? How would the DPHSS explain this lapse in judgment to the public who counted on your policies and actions to prevent local dengue infection? Dr. Pobutsky wrote, telling us that dengue is not spread from person to person, but we never asked her about that. We knew that answer from speaking with Ms. Rabago, her colleague in a different office of public health. The same colleague who told us that the dengue-capable mosquito could very well bite the then suspected dengue patient and then carry the disease to another person. This story of the return of a dengue epidemic to this island after 75 years is a classic fable of the left hand not knowing what the right hand is up to. Ms. Rabago and her Division of Environmental Health, who knew of the dangers of exposing the suspected patient to the mosquitoes, had no power over quarantine of the patient. Dr. Pobutsky, who did have this authority, apparently didn't understand the dangers of exposure to the public's health. Meanwhile, the person who could have seen the missing links in this matrix of prevention of an epidemic, the Director of Public Health, Linda DeNorsi, was copied in all of these emails and never said a word. Neither did her boss, Governor Lou Leon Guerrero, a nurse who understands public health policy, or at least should, since she's a nurse. This matter now is beyond an issue of public health policy. It has entered the realm of civil defense, though it has taken nearly a week for the Office of Civil Defense to be mobilized by the Homeland Security Advisor and the governor. The non-urgent response for the greatest public health crisis of our time has been slow. That likely has to do with the lack of protocols to address a dengue outbreak in the island's Guam Emergency Recovery Plan. None exists. Civil defense spent a lot of money and time going over what to do about a SARS outbreak and a Zika virus problem, but never dengue. Today's response received by the media at 6:30 p.m. tells us first that the governor finally has activated the Joint Information Center to handle the communications of the response to this crisis, and that the government is trying to get it together. And so here's what the Civil Defense tells us. This is the news release from Civil Defense. We can go back to the wide camera. So, no, hold on, I have to find it. That was almost perfect professional. Sorry, Chella. I mixed. I screwed that one up. This was issued at 6:39. Well, it arrived in our inboxes at 6:39 p.m. Issued at 6:30 p.m. from the Joint Information Center. It's JIC release number 1 on this dengue thing, and this is almost a week after the confirmation that there's a local case of dengue. On September 11, 2019, the Guam Public Health Laboratory of Public Health confirmed the first locally acquired case of dengue fever. The virus, type 3, is the same affecting Yap, Palau, Marshall Islands, and the Philippines. The individual had no recent history of travel outside of Guam. To prevent further spread of dengue virus, Public Health, through the Division of Environmental Health, has requested assistance from a local contractor to conduct insecticide application. Oh, this is why at Agata Johnson Middle School and Orat Chalampago Elementary School.
So it's in that area.
I would not send my kids to school, man. Holy cow. Residents in the 200-meter radius of the confirmed case will also be asked to have their homes sprayed both inside and outside with insecticides to control adult and larval mosquitoes.
What a bunch of crock of shit, Troy.
This
could have all been prevented.
If they had just quarantined that suspected patient. Mm-hmm. If they didn't act like they were better than everyone else, and that a couple of...
Maybe the doctor doesn't have mosquitoes in her high-rise condominium.
But it almost sounds like the doctor just wasn't aware of the perspective that the vector control unit had. This is really the director. The director had the perspective of what was going on and could have said, doctor, you need to quarantine that patient because our mosquito people are telling us that this mosquito can bite that patient and then transmit the disease to someone else.
No communication.
The left hand don't know what the right hand is doing. And in the trite responses that we got from Dr. Pobutsky, it was like she just didn't get it. And I'm like, woman, you're a doctor. Like, I'm just a dumb person without a degree. You're a freaking doctor. What don't you, and your misunderstanding of the situation now has caused the first local dengue infection in 75 years. Happy Liberation, Guam. L75. Maybe Kathy Flores will prop up some fireworks for our first dengue fever case on this island. And a potluck from island cuisine. So, man, so I exercise and like as soon as I get up, I do like this 1 minute calisthenic thing, right? Every time I go outside, I'm like, man, I'm gonna get dengue because they said that the mosquitoes are most prevalent at dusk and at dawn.
Wait, go back. I want you to go back to that press release from DOE.
The one about the...
Why?
Oh, yeah.
Johnson, and
fucking Dawkins, man. Oh, it's right here. Sorry.
Read it out loud again, Troy.
Hold on.
Look at this communication. What do we tell the public? This is what you're going to tell the public.
Dude, DOE straight up lied to the public. Okay, classes will be canceled at Agata and OCP tomorrow, Monday, September 16. Classes are expected to resume as regularly scheduled at all other DOE schools. The school closures will provide an opportunity for school administrators to disseminate information about the recent insecticide spraying protocols and other pertinent information to faculty, staff, and students. We want to provide ample time for our school administrators to complete the work to be done at our campuses. Oh, you know what? It is. It's about the insecticide. Yeah. They said insecticide. They just weren't all that clear about it.
It's almost like it sounds like a training.
Yes.
Yeah, they're not.
Or like they're gonna collect all the composition notebooks and start grading. Or they're gonna prepare for parent-teacher conference. They're preparing for mosquito
this is
attack.
Political.
Yeah.
This is a political answer.
Yeah, it
Instead
is.
of saying, guys, the dengue outbreak is in or not. So everybody, you get what I'm saying? Am I just being?
Let me tell you this much. I ain't fucking going to Ordot or Chalapago. Like if anyone needs anything in the central area of this island, don't fucking call me because I'm not gonna go do it for you. I'm gonna stay my ass up north and away from those mosquitoes. No, see, this is a big dengue is dangerous. Okay, this is what. So civil defense does provide more information about this. Okay, dengue fever is transmitted to humans by the bite of an infected mosquito. Oh, yeah, we know that now, and cannot spread directly from person to person. The best preventive measure for residents living in areas infested with mosquitoes is to eliminate areas where mosquitoes lay eggs, which are primarily artificial containers that hold water.
No,
It's
not all
also
the
like-
time.
it's also like
I live
lakes,
I
right?
live next to the jungle. I cannot go out to the jungle and take my blower and blow it so there's no water lane. Okay?
Because it's in the leaves, like that's enough
Right.
water for the mosquitoes to
Yes.
fester.
Thank you, Dr. Pabupski.
Public health is working.
Fired. Hey,
No, really, she should be fired.
she should be fired.
75 years of no dengue, and all of a sudden, because of a lapse in judgment, the director of public health should be fired. The
Guam?
epidemiologist should be fired.
Guys, you know, I really think that we should be really upset about this. This is crazy.
This is the worst thing a governor has done. This is the worst thing a governor has done in my memory of working in political office.
So if it was Governor Calvo,
Governor Calvo led the
The
Zika
moment-
virus response. He was like, it was like that. SARS, Governor Camacho was like that. Mm-hmm. This one, and she's a freaking nurse. You would think that she would have got her fat ass up to do something.
you know, Troy, I was just going with the information that I had, Troy.
Is that before or after she runs away from the
During,
cameras?
you know, Troy,
But Chelo, this is a big deal.
it is. I'm as angry as you are. Can't you tell?
So, for people with compromised immune systems, it's already a big deal. For old people, for babies, kids, anyone who's going through cancer, HIV, diabetes, all these things, right? And there's a lot of people on this island who have compromised immune systems.
Diabetes, all of them.
But even if you're healthy, you're susceptible to die from dengue fever. That's how powerful this thing is.
So now that this happened, is Guam prepared for an outbreak? Do we have medication? Do we have what we need?
We should ask those questions tomorrow and see if Lillian Posadas answers these questions and the other questions that we sent her that she still hasn't answered yet. We have a very non-transparent government. I hope we all can acknowledge that and recognize just how non-transparent this government
Yeah,
is
and
about
if I
very
get
important
dengue-
information.
You best believe I'm going to sue.
No kidding. No kidding. This complete lapse in judgment from public health. And we rely on this agency to have prevented exactly what they didn't prevent because they made a mistake.
No, but this day and age, it shouldn't be happening. We aren't those areas. I'm not saying that those areas are bad, or I don't know how to say it without sounding
Dengue virus is a third world
okay.
country
We
kind of
aren't
thing.
third world because of our technology and the people that get paid over $100,000 a year.
We have $1 million mosquito lab. We have a mosquito. We don't even have a weed lab. We have $1 million mosquito lab. So much for the fucking mosquito lab. Dengue is a disease caused by any one of four closely related dengue viruses. The viruses are transmitted to humans by the bite of an infected mosquito. It's called the Aedes aegypti. Anyway, what can I do to prevent the spread of dengue fever? Take precautions in preventing mosquito bites. I think you can get like off, or you can even use natural remedies. I don't remember what they are.
You can burn the husk of the coconuts, any smoke. Even if you have cardboard, if you burn that, they kill mosquitoes. Okay. So if you're worried around your house, worried about the areas around your house, just do that. And so typical Chamorro like this. If you catch dengue, they're gonna say this, girl. You didn't get rid of the water that was sitting around your house. It's your fault. Doubt.
No, the typical Chamorro response is going to be, you got dengue, girl? Is it because you slept with a mosquito? Properly cover or dispose of all containers that collect.
No, if you start dating a guy that, we didn't do it because his own mosquito was very small. I thought I was gonna get dengue. How come you don't want to do it to me? Because it looks like a mosquito, and I was scared I was gonna get dengue. Just kidding. Sorry, guys.
Bloodsuckers. Properly cover or dispose of all containers that collect rainwater or water, such as flower pots, garbage cans, recycling containers, wheelbarrows, aluminum cans, boat tarps, old tires, and buckets. Oh, boat tarps. Holy shit, everyone's going to have to take it down their outside kitchens. Flush bird baths and wading pools weekly. Flush ornamental bromeliads with water or treat with BTI, a biological larvicide available at most home stores. Clean roof gutters, which can become clogged and hold water. Look at all this stuff that we have to do because people at public health weren't doing their damn jobs. Change the water in outdoor pet dishes regularly. Keep pools and spas chlorinated and filtered. Stock ornamental ponds with mosquito-eating fish. Can you tell us what those are? Cover rain barrels with screening. Check for standing water under houses, near plumbing drains, under air conditioner drip areas, around septic tanks and water pumps. This is a full-time job. Take steps to eliminate standing water, improve drainage, and prevent future puddling. What are the good luck with that, Guam, with all the rain that we just had today.
Thanks a lot, public health.
What are the symptoms? Okay, principal symptoms include high fever, severe headache, severe pain behind the eyes, joint pain, muscle and bone pain, rash, and mild bleeding, usually around nose or gums. Dengue hemorrhagic fever, the severe form of the disease, is characterized by a fever that lasts from, 2 to 7 days, which can be followed by persistent vomiting, severe abdominal pain, and difficulty breathing. Patients with dengue hemorrhagic fever tend to bruise easily or other skin hemorrhages and possibly even internal bleeding. There is no vaccine for preventing dengue fever. What do you do if you feel sick? Talk to your doctor or nurse if you feel seriously ill. And for those of you who don't have access to a doctor or a nurse, I guess what public health is trying to tell you is, too fucking bad. The hospital is going to be inundated as soon as people get fevers.
It's already inundated. People are they're pushing them to GRMC already.
Talk to your doctor or nurse if you feel seriously ill, especially if you have a fever with other symptoms such as headache and joint pain, or have traveled to a country with locally occurring. Oh, you don't even have to travel to a dengue country anymore.
Yeah, we're dengue.
You just have to travel to Ordot Chalampago.
And you don't need a passport for that.
Oh shit! Let's move back to Jigo. I'm feeling pretty safe with the bugs in Jigo now. Consult with your doctor about the use of acetaminophen to treat fever and pain. Get lots of rest and drink plenty of liquids. You guys are telling us nothing. Avoid spreading the disease by preventing more mosquito bites. You need to tell public health about these instructions, man. What should I know?
Never mind, we're not traveling. You don't have to read that. That is retarded. Fucking, do not waste 30 more seconds of my motherfucking hearing time.
So
Did they cut and paste
stupid.
this from something?
I don't know, Shelly, but there's some grammatical and spelling errors too.
Of course. Of course. Thank you, Joint Information Center.
You might want to proofread your work before you send it out next time.
Dengue, hemorrhagic fever.
And I don't know what to say about anything. The governor has really failed us. Like directly, the governor. This is an issue. This was one of those things where the leader. It was a
Should've took
common
charge.
sense thing. The mosquito.
Common sense. They don't have common sense. They have common sense.
It wasn't anything that was like rocket science or molecular science. It was common sense science, like mosquito, person, dengue.
Not to be confused with dengue, hemorrhoidic fever.
And now we have an outbreak of dengue virus for the first time in 75 years. Biba liberation. When we come back, we're gonna trash talk more.